Hello, my name is Frances Reid. I'm Programme Director for the World Ovarian Cancer Coalition. For this champion chat, I'm delighted to welcome Charo Hierro, who is President of ASACO in Spain. And she's here to talk to us today about their programme Proyecto Bienestar. Charo, can you tell me, first off, what is the programme about?
Well, yes, this program was born in 2014 because we realized that women with ovarian cancer, and not only the patients, but their families too, had a need for psychological support.
And it involves a psychological counsellor, professional, working with women.
Yes, of course. There are a number of psycho-oncologists. Most of them are women that receive patients and they listen to them, and not only patients, but their families too. Because, well, this project has two arms, in fact. One is for psychology and the other one is for physiotherapy. And in the one for psychology, both patients and their families, their loved ones, can be treated. But for physiotherapy, of course, only patients, because there are sessions that manage with some problems they may have after surgery, you know. But the professional, the psycho-oncologist, dates them for a certain time. Previous to the pandemic, the sessions were person to person, but since we are having this problem, the sessions are online, so it is much easier for both, for the psychologist and for the patient, to arrange a time and have their conversations, their sessions.
So in fact, the pandemic has made it easier to run the programme.
Somehow, yes, it has. We know that it's different to be person to person and have a conversation in the same place, sharing your room, a table, whatever. But it's true that as we couldn't move or we were confined, it has made it much easier. And of course, for people who live far away from big towns, in rural areas, for example, they had some problems to attend the office of the psycho-oncologist, and this way they are, well, at reach at any time, you know. So somehow, yes, it has been a good thing. So yes, this period.
And women have access to the psycho-oncologist for up to 6 months.
Well, it's not a question of months. The project is that any patient has right to have 20 sessions with the psycho-oncologist, no matter if they last for example, 3 months, 4, 6. And after these 20 sessions, if the psychologist thinks that the patient needs more, we can enlarge this quantity in blocks of 5, and according to the needs the patient has, and until the psychologist says, well, I think she is all right and she can stop having these sessions. So, but it is 20 sessions. Usually the psychologists prefer to have a session per week, but this depends on the convenience of the patient too.
So many women with ovarian cancer experience emotional distress, anxiety, and depression.
Yes.
What can the psycho-oncologist deal with? Are they dealing in particular subjects, or is it just that the patient finds it very hard to move on?
Yes, well, it depends, because we think that psycho-oncology should be present since the moment of diagnosis. That would be very important. That would be great, because there are many doctors that can communicate the diagnosis, a very, very stressing diagnosis, and very, very serious, in a good way. And at the same time, as they are telling you that you have this illness and it is very serious and we have to do this and this, they are able to give you some strength to go on, but some others aren't prepared to do it this way. So we think that the moment of the diagnosis is very, very important because it's shocking, and you don't really know what you are being said. You are completely, well, most times it is a very, very huge surprise because many women, and I include myself in them, have never heard about ovarian cancer. And this is something that, well, is shocking, completely shocking, not only for the patient, but for the families too. And this is a very important moment. Then there is another very, very hard moment that is when you live, for example, well, the usual way of facing ovarian cancer is you have your diagnosis, you have your surgery, and afterwards the chemotherapy. And many other times you have some sessions of chemotherapy and an interval surgery, and the rest of sessions of chemotherapy after recovering from your surgery, you know. But when you finish your chemotherapy, so the first line treatment, to say it, you feel abandoned, you know, and you say, well, I have been coming to hospital every 20 days or less than 20 days. I have seen my doctors every time I came, and now I am alone. And you really feel alone. So this is a very difficult moment, the moment of finishing the chemotherapy. And apart from this, the cases that, well, sadly, there are many that the illness, well, is recurrent. There is another moment that is very, very hard for both the patients and the families. We have seen that in many occasions, the patient is stronger than the family, than her family, I mean. I don't know why, and sometimes when we are talking among us, we think that our mind somehow finds a switch or something that tells you, well, now I have to fight and I am going to concentrate in this.
How do women access the program? Do they come to you, or do the doctors refer women to you?
Well, the doctors that know us, and there are many, but not as many as we would like, usually refer their patients to us. We are very active on social media too, so that we share this project every certain time and say, don't forget, we count with this project. So many women come to us through this media. Many doctors in Spain are not so fond of encouraging their patients to participate or to get in touch with an association. That's something that should be better, but well, nowadays it's like this. But yes, of course, the doctors that know us and know how we work, they always try that their patients get in touch with us.
I wish you the best for that in the future.
Yeah.
Do you have any top tips if another organisation somewhere else in the world was thinking about a programme like this? What would you say?
Well, the most difficult perhaps is to design it, to make a good project and explain what you want, how you propose to do it, etc. And then, of course, finding money for it. The year we began with this in 2014. We presented the project to the social area of a bank in Spain, of CaixaBank, and we got the grant we had asked for, with a little help of a pharma company too. But the help of the pharma company was small. And we can present this project every 2 years, and sometimes we are given the grant, and sometimes we aren't. So what we do is, as we have been able to make some savings for the association when we don't receive the grant, we employ this money in our piggy bank, you say, to go on with the project, you know. And so the most difficult is to find money to run it and to not to stop it, or to give a continuity to the project. Mm-hmm.
Well, thank you ever so much. I wish you all the best in finding money for the wonderful project in the future.
Thank you very much, Francis.
Thank you very much, Charo.